Hello, good afternoon. I'm Dr. Mercer. I'm from the intensive care unit here at this hospital. The doctor from the emergency department asked me to come and have a chat with you. He's told me all about what's been going on and what treatment they've given you already. I'm from the intensive care unit, and I just wanted to come and talk to you about a few other things as well. You okay if I call you Edith? Is that right?
Yeah, I like that name.
And it's Alison, you're Edith's daughter,
yeah.
that's right, okay. Just want to start with Edith. Feel free to join in as well, please, Alison. Just wanted to start with asking you how things have been at home in the past few weeks and months. Could you tell me how you've been?
They've not been good, Doctor. They've been bad. Oh, it's been getting worse.
What, your breathing's been getting worse?
Breathing's been getting really bad. Yeah.
Okay.
Yeah.
I mean, you've had to move in with me, haven't you, Mum, in the last month?
That's right. I couldn't manage.
Okay.
I couldn't manage.
And what kind of house do you live in?
Well, we've had to put her on the ground floor because she just can't manage stairs anymore, Doctor. Can you, Mum?
No.
So we've put her in our spare room downstairs.
Okay. Is it the breathing that's stopping your mum get up and down the stairs?
Yeah, I think it is, isn't it, Mum?
Every time I move my body, I just got no breath, you know.
Right, I'm sorry
just
to hear
goes.
that. Okay. Have you had to call your local GP very often?
Well, he's been coming out. Well, it must be nearly every week, sometimes twice a week, isn't it, Mum?
Okay, always about the breathing problem?
But, yeah, about the breathing and just not being able to move without getting out of breath.
He's tried very hard.
Have they been suggesting any treatments?
Was it nebulizers?
Nebulizers,
wasn't
yes.
it? And
That's
maybe even they did say about oxygen, didn't they? But
Yeah,
last
they
time
did.
he was out, he said oxygen as well.
That's right.
Okay, the oxygen at home.
Yeah.
And your chest, it's been bad for a while, I understand, is that right?
It feels like a ton of bricks. Lead.
Have you been in hospital?
Yeah.
Say how many times in the past 6 months have you been in hospital?
Well, it must be 4 or 5. It must be about 5 times, mustn't it, Mum?
I think so. Yeah, almost
Out
every
of
month.
hospital, come back in again.
Yeah.
Oh dear, okay.
Yeah.
Is this the worst your breathing's ever been?
I think this is the worst it's ever been. I really wonder what was happening this last time.
Sorry to hear that. So what can you do when your breathing's at its best, say, Edith? What can you do around in your daughter's home? Can you get around on the ground floor okay?
I'm chair bound really. Once I'm in the chair, it's hard to get into the commode. I sit on the commode.
Right, okay.
Really, really hard.
Yeah.
Is that your breathing again?
It's every time I move my body, it's like trying to get up out of the chair, the effort that's needed. Whew, it's awful.
It's hard work, isn't it, Mum?
Yeah.
So am I right in thinking your breathing's got quite worse over the past few months?
I think it has, Mum, you know.
I think so.
Yeah,
I think so.
The other doctor was saying you've had emphysema, you've had that for years, is that right?
That's been a real problem.
Have you ever been a smoker?
Well, you were, Mum, come on. You used to, didn't you?
Well, a long time ago.
All right, okay.
Yeah, I've been off the cigs, off the fags for ages now.
Okay. Well, I've been called to see you, Edith, because I think, as you fully understand, your breathing's rather bad at the moment. And like you said yourself, this is probably the worst attack you've ever had. The other doctor was telling me about all the blood results and investigations and tests they've done, and it does look like your breathing is quite seriously a problem at the moment. I've been called from the intensive care unit because we do have extra treatments that potentially might be something we would consider for you, and that's why I'm here to discuss them. The first one I wanted to discuss was how we might be able to help your breathing. One of the blood tests does show that your breathing is deteriorating. Your carbon dioxide level, in fact, is going up quite high.
Is that serious?
It is, I'm afraid. That means you're not breathing sufficiently, and it'll be hard for your breathing to carry on like that without us having to help it. The kind of thing we can help you with on intensive care would be a breathing machine.
Machine?
It's a machine that could actually take over your breathing for you. To do that, we have to give you an anaesthetic.
Oh dear.
And then when you're asleep, we would take over your breathing for you. I don't know if you've
Is that
ever thought about things like this yourself, Edith?
That sounds quite serious, doesn't it?
It is, I'm afraid. It is very serious if it came to
Is
that.
that just for a few hours, or?
It's hard to know, probably not. The trouble with the breathing machine is, especially for a lady whose breathing isn't very good, is the main difficulty is getting your mum off the breathing machine, and that could prove very, very difficult.
On a machine. And then, I don't know, would I survive the anaesthetic? That's a big thing, isn't it?
Well, you're right to query these things with me, because I think from my medical perspective, I don't think it would be the right treatment for you, because I think you may not actually survive the anaesthetic, and you may not survive us putting you on the breathing machine if things got that bad.
That's a relief, isn't it? Really?
And similarly, I don't think we may ever get you off the breathing machine.
Oh, it doesn't sound like an option.
Yes, I agree.
I don't think that's an option we can consider.
Okay.
Consider really.
I agree with you.
That's a struggle. No.
I think there are other breathing options we have that could help you breathing that doesn't involve coming to the intensive care unit. There are other types of face masks we can help you with that can help you breathing, which is probably the better way forward. The other problem at the moment is your blood pressure's very low, and that's probably because you've got a bit dehydrated. They've given you some fluid into your drip here, and still your blood pressure's quite low. That's probably because you've got an infection in your chest. Again, on the intensive care unit, we have medicines we can give you to try and get your blood pressure back up.
Is that like a tablet?
It's not, I'm afraid. It would mean putting probably a drip in your mum's neck and infusing medicines into that.
Oh,
holding my neck.
that sounds quite a big
And
thing.
supporting the blood pressure.
That sounds a big thing.
What do you think, Alison?
I just know how much you've been suffering the last few months.
Yeah, I have.
Okay.
Yeah.
Just more suffering.
I don't. If you don't mind, Ali, I think I'll just say no to that. I think.
Well,
Yeah.
yeah.
You sure?
I have to agree. I agree with what you're saying, because I think it probably would be of little benefit to you anyway. I'm sorry to have to keep loading all these these very tricky questions.
I want to know what the real situation is.
We want the truth, don't we?
We really do want the truth, don't we? Yeah.
And the last thing I want to talk to you about is your heart. Obviously, you are quite sick at the moment. Your breathing is suffering. It's putting a real strain on your heart. Your heart's going very fast at the moment. There is a chance with all this strain being put on your heart with this illness, your heart could actually stop. The ways we have to restart hearts, you've probably seen it on the television, is CPR, cardiopulmonary resuscitation, where we have to do chest compressions.
My mum did that on first aid. That's for cardiac arrest.
It is, yes.
It's like emergency ward 10. Is that what they do on there?
It's not very nice.
No,
I don't like the thought of you being...
No, I don't want these machines. I honestly don't want any more machines and any more talk of machines.
Okay, I fully understand.
No, I don't think I'm up to that.
Because I
as for
totally agree
thumping
with you.
my heart, that sounds awful.
I think you're being very sensible, because again, I think if things got to that stage such that your heart did suffer and did stop, I think our chances of getting it started again would be remote. Yeah. And I agree with what you're saying. I personally don't think it would be a good idea to even try it if things got that bad.
Look, doctor, when my heart stops, that will be the time.
Okay.
That will be the time.
I understand what you're saying.
I'll be ready. I'm ready. I'm ready to go when my time is up.
Okay. Thank you for being so sensible.
Yeah, I've had a good life, haven't I?
Yeah.
I've done lots of good things, and I'm very thankful to the dear Lord who's given me all that. And when my time comes, I'm ready. I'm ready to go.
Well, thank you, Edith.
That's the way I look at it. Yeah.
However, we're not giving up on you. I have to state that. All we've so far talked about is things that I do on the intensive care unit that probably aren't of value to you. They've already started some good treatment here in the emergency room.
Yeah.
They've got a drip going, they've got lots of fluid, hopefully that will bring your blood pressure up. They could start you on antibiotics and treatments for your chest. All these are good treatments, and they may get you through this. And so, yes, you won't hear from me from the intensive care unit again, but they'll still carry on the chest ward here with some very good treatments that hopefully will get you through this. But I think you've been very sensible about the kind of things I've had to discuss.
That sounds good. That sounds good.
Right, Mum, doesn't it?
Yeah.
Okay. What I'm going to do is, I've got some paperwork, I will document this discussion, because what I want to make sure is you don't have to have this kind of discussion with any other doctor and keep repeating yourself.
That would be helpful.
I can write it down.
That would be helpful.
So we have a plan, and all the doctors and nurses throughout your hospital stay know exactly what we are and are not going to do for you. Okay, is there any other questions you had for me, Edith?
I don't think so. I just want to say, I think thank you so much for your care.
Thank you, Doctor.
Okay.
Thank you for being honest, Doctor, as well.
Okay, thank you for your time.
Thank you.
I'll head off now, and I'll get the medical team to come back and see you and take it from there.
That sounds really good.
Okay, thank you.
Thank you so much. Yeah.